Hello there, folks. Welcome to my brain wreck. This channel is about my brain wreck because my brain took a wreck. I had nocturnal seizures, and I was just diagnosed with epilepsy a couple weeks ago. But I decided to start this channel just to pass on information and stuff. And just my disclaimer here: this is just information that I look up and I research and stuff like that, and I put the website into my description. So do not take any of this as medical information or anything like that for me personally. If you need to understand it, please contact your medical team, your professionals and stuff like that, your doctors and neurologists and stuff. Well, this I found was very interesting, and I was just wondering about ADHD and epilepsy. So what I'm going to do here, basically, I'm just going to read some here. No, this isn't going to be a very long video. I'm just going to reading about ADHD and epilepsy, how it's connected possibly somehow in bilateral directions, and there's probably actually different ideas if it is or isn't right now. So I'm just going to read from here. This is from sciencedirect.com. All right. So just going to read a few things about it on here. Says the ADHD in adults with epilepsy, a guide for neurologists. So the highlights they're going to talk about in here is ADHD medication can be safely considered in people with epilepsy. So they're going to use that as PWE as an abbreviation, people with epilepsy. And then also anti-seizure medication should be reviewed for cognitive risks. It's going to affect them in any way, shape, or form. Sorry if I bumped the stand here. And failed medication trials and or complex psychiatric history should prompt a psychiatric referral. So here's the abstract, folks. So, like I said, I've had 3 nocturnal seizures, and I finally got diagnosed with epilepsy. I never had any seizures until the age of 48. Right now, they are under control at the moment, with my anti-seizure meds, my seizure meds, obviously. So hopefully it stays that way, maybe. But I've been having a hard time with the medicines and stuff. They've been working and stuff, but I've been having a lot of time focusing and losing my memory on things and not remembering simple tasks, or I've been asked to do separate tasks and stuff like that, but I forget them. Alright, so I'm going to read this. This is the abstract from sciencedirect.com. So, attention deficit hyperactivity disorder, ADHD, and epilepsy have one of the lesser known and yet highly debated relationships in neuropsychiatry. So, similar to anxiety and depression, ADHD has a bidirectional relationship with epilepsy. So, bi meaning 2, obviously, in which individuals with epilepsy are more likely than general population to have ADHD and vice versa. So that's very interesting. You go both ways. They can have ADHD more than the epilepsy, or the epilepsy can be more versus the ADHD. So most importantly, an untreated psychiatric condition can affect quality of life, which all of us know that have epilepsy and stuff, that definitely does affect our quality of life. We know that from people thinking we're just a stigma and stuff like that, but we're not stigmas. We are people too that just have a medical problem, that our brain took a wreck, my brain wreck. That's why I call this channel my brain wreck. Although the management of the ADHD in people with epilepsy has been debated due to perceived seizures risk related to ADHD, medications consensus has been based on early pediatric studies, all right, that support the treatment of ADHD. But, however, the management of adults with ADHD, particularly in people with epilepsy, remains relatively unexplored. So they haven't really explored that much, but obviously there's a lot of research out there going on with that. And as I mentioned in my other videos and stuff too, that I don't think there's enough funding for epilepsy, and it's not recognized as much as it should be, and and how epilepsy works and why is it, and how is epilepsy different from seizures. Yes, there are seizures of epilepsy, but there's different things. You can just have a seizure disorder, not epilepsy. A lot of people don't realize that. So, however, the management of adults with ADHD, particularly in people with epilepsy, remains relatively unexplored. So, it's a critical gap in knowledge will be addressed using an illustrated case study followed by practical tips on the identification and pharmacologic. All right. Management of ADHD in adults with epilepsy. So the management of ADHD in people with epilepsy should begin with a thorough history, medication assessment for cognitive risk, and addition of a brief ADHD screening tool, such as the Adult ADHD Self-Report Scale. All right. Remind you, the stuff I'm writing here is for neurologists, to help them understand or whatever. So obviously, this is stuff was written by doctors, you know, top doctors or whatever to help understand epilepsy with ADHD combined. So a treatment with stimulants such as methylphenidate and non-stimulants such as atomoxetine are effective. And as I said, I'm not a doctor, so I don't know what these medical terms are, medical words are, or anything like that, what they do, what's the name for them, and how it works. So this is information purposes only, all right? So please consult with your doctor or your neurologist or a pathologist, about this stuff that I'm reading to you, all right? Now, caution, however, should be taken for any patients with a history of bipolar disorders, as some ADHD medications may exacerbate symptoms of their psychiatric conditions. So it's possible it can make it worse, possibly, make their ADHD worse and just cause much more worse and up their hyperactivity and deficit. That's from what I understand from reading this. Patients can also be referred to as psychotherapy, such as cognitive behavior therapy, which is CBT, not CBD, for ADHD in addition to or in lieu of medications, thus further minimizing potential pharmacological risks. Patients who have tried and failed multiple ADHD medications and or who carry a more complex psychiatric history should be referred to a psychiatrist, obviously. All right. So now we're down in here. I'm just going to read. This is an illustrative case, obviously. This is written. Okay. So, like I said, this stuff is for neurologists. This is passed on. This is written by Science Direct. All right. So, it's from science people, doctors with prior degrees within science and so forth. So, this is an illustrative case that I'm going to talk about here. This is a 30-year-old male presents to an outpatient neurology clinic to establish care after a recent move. He is diagnosed with epilepsy in college. He is adherent to 1,500 milligrams nightly of extended release divalproex sodium and reports he has been seizure free for over 5 years. At the visit, he discloses a history of attention deficit hyperdisorder diagnosed in childhood and treated with amphetamine, which was stopped in college by his previous neurologist. So over the past few years since the COVID-19 pandemic, all right, so this is during the pandemic they're talking about. So I'm guessing this is a real case. So obviously, the patient has been working as a freelance programmer from home and taking online graduate courses at night. He has noted worsening difficulty maintaining focus and easy distractibility. He has trouble balancing multiple projects, misses deadlines, and sometimes finds himself spacing out during Zoom meetings for work. When my wife first saw, she's seen to myself. She's told me, she said, "Look, I've spaced out a few times or whatever, and I'm just zoning out. I'm just like kind of looking like this, and I know they're there and stuff, but I'm not paying attention or nothing. And then all of a sudden I get zoned back in, I guess you could say. So he had a panic attack for the first time last week and has been having trouble falling asleep for the past few days. His partner is concerned because he has turned down multiple invitations from friends to instead spend time on work. He avoids taking on new projects, and this all beginning to affect his personal and professional relationships. He denies any substance use and has never seen a therapist. The patient asks his neurologist about starting a new treatment for ADHD, but worries about how additional medication may affect his seizures. Alright, so now we're going to talk about the prevalence and impact. Alright, so that was just the case that they're talking about and stuff like that. So prevalence and impact. So basically ADHD is typically diagnosed in childhood, and children with epilepsy have a considerably high risk of ADHD, 25% prevalence in children with epilepsy, and up to 77% prevalence in a sample with epileptic encephalopathy. Excuse me, I don't pronounce that right. Compared to the general population, 3 to 5% prevalence. ADHD can also be found in 2.5% of adults overall and as many as 1 in 5 adults with epilepsy. So that's very interesting. Many as 1 in 5, so that's pretty high actually, in my opinion. 1 in 5 adults with ADHD. Negative impacts of ADHD can lead to psychosocial morbidity and poor quality of life. So obviously people with epilepsy or ADHD may have a poor quality of life because, they're distracted, they're not paying attention to things, and something's causing it. It could be the medicines, maybe. I'm not sure. Well, that's what they're trying to do and research for. Despite changes that were implemented in the 5th edition of the Diagnostic Statistics Manual of Mental Disorders, DSM-5, and I think they have come out with one every, DSM-5. I think there might be more than one. Probably DSM-6 now or 7. I don't know. So the only reason I know this is my wife has she has a bachelor's in psychology, so I don't know everything. She's super smart. Despite changes that were implemented in the 5th edition of the Diagnostic and Statistics Manual of Mental Disorders, wherein ADHD criteria for adults now only require 5 symptoms compared to 6 symptoms for younger adolescents and children. There remains a stark discrepancy between adult and childhood ADHD rates that some studies believe may have been influenced by genetic or even environmental factors. So it could be environmental factors, could be medicine stuff, maybe environment growing up with or something. It's hard to say. How you're taken care of, how you're going to the doctors and stuff like that. That could be a possibility. Environment plays, in my humble opinion, environmental plays a lot in your history of how you grow up in your childhood and stuff, and where you live at and stuff like that. I believe, and or how do you call it, your status in society, poor, middle class, upper class, super rich, is a possibility. I think maybe possibly. So a systematic review by French, etc. all highlighted barriers to diagnosis such as lack of ADHD, education in primary care settings, and false beliefs that ADHD only occurs in childhood. In fact, however, 15 to 20% of children with ADHD continue into adulthood with a full syndrome, and 50% experience impairment. So, as adults with only subsyndromal symptoms, subsyndromal symptoms, mild, whatever, supposedly. And comparing inattentive versus hyperactivity and impulsivity symptoms. Inattentive symptoms tend to persist at higher rates. Inattentive presentations, which occur predominantly in females with ADHD, may easily go undetected by others because the symptoms may only directly affect the individual. Therefore, female adults are referral bias compared to males who often receive much more recognition in childhood because of a hyperactivity ADHD presentation that can affect the people around them in school and at home, are due to a comorbid conduct disorder. Behavior that might include violence and theft. Further still, people with high intelligence and ADHD may not manifest with symptom severity or seek treatment until they are faced with the challenges of higher cognitive requirements. So, clinical signs and symptoms of ADHD. So for those that are taking psychology classes and stuff like that, so those might be helpful to you or whatever. In the DSM, we'll just call it the DSM, 5th edition, categorizes ADHD as a neurodevelopment disorder, thus presenting with several symptoms before age 12. These symptoms lead to impairment in at least 2 different things, affect personal, social, academic, and or occupational functioning, and are not better explained by another disorder. Specifiers include combined inattention and hyperactivity presentation. Predominantly inattentive presentation are predominantly hyperactivity impulsive presentation, or ADHD HT. Now, to meet the criteria for ADHD, IT. A minimum of 5 symptoms must have persisted for at least 6 months. These symptoms may include a lack of attention to detail, difficult with sustained attention, the appearance of conversational disengagement, failure to follow through with tasks, difficulty with organization, avoidance of sustained attention activities, misplaced objects, and forgetfulness in the daily activities. I notice myself, I have forgetfulness in daily activities and stuff like that. Like I said, my wife asked me to do something, and I just can't remember what it is or why and how. It's a very simple task, you know. You can just give me a list and she'll ask me to repeat it back, and I can't repeat it all back. I get like part of it. So to meet the criteria for it, a minimum of 5 symptoms must have persisted for at least 6 months. So these symptoms may include fidgeting, frequently leaving one's seat, inappropriately extremely restless activity, frequently an inability to engage in leisure activities quietly, discomforting sitting still, talking excessively, blurring out answers, difficulty waiting their turn, or intrusiveness. This patient reports child onset symptoms that occur in at least 2 different settings, more than 6 months of symptoms, with 3 symptoms considered with ADHD/IT. So we got differential diagnosis. Other mental health conditions. Multiple mental health conditions should be considered in the differential diagnosis of ADHD. Alright. So as you can see here, that's why they think there's a bilateral connection here with people with epilepsy. So you guys who have epilepsy and you may have been diagnosed with ADHD, so you guys might be able to see why you have trouble with certain things possibly. Now that I'm reading this and stuff, I'm trying to wonder myself, do I have ADHD? You don't know. Never been diagnosed with it or anything, so maybe there's a possibility I should be tested for it somehow. Not sure how it works or whatever, how the testing is done. So that's one thing to consider for you people out there that have epilepsy, like myself and everybody else that does have a seizure disorder of some type. Now, anxiety. Severe anxiety can manifest as inattention or hyperactivity state of agitation that is similar to the descriptions of ADHD. However, ADHD is not associated with chronic pervasive worry that defines generalized anxiety disorder, nor is ADHD associated with a paroxysmal physical manifestations of panic attacks. Over time, however, patients with underrated ADHD can present with specific worries secondary to the disabling effects of ADHD symptoms. When anxiety is a secondary ADHD symptoms, the anxiety resolves with ADHD treatment, and so forth. Okay, now we're getting down to some different stuff down here. Bipolar disorder. Both ADHD and bipolar disorder have similar presentations such as poor concentration or distractibility and increased impulsivity. In bipolar disorder, however, patients must experience a manic or hypomanic episode consisting of a distinct period of abnormally elevated or irritable mood, lasting consistently over 1 week in mania or 4 days in hypomania. Patients may not always recall their manic episodes. This records information gathered with patient permission from close family and friends and family history of bipolar disorder diagnosed by a psychiatrist are helpful for diagnosis clarification between ADHD and bipolar disorder. Alright guys, so as I mentioned, this is from a neurologist. This is written out by a neurologist, and some of the stuff from the Statistics DSM edition 5. So depression. Untreated depression may lead to subject cognitive changes. We've all had depression, a lot of us, especially when you get diagnosed with epilepsy or some type of seizure disorder or something else. We've all been there. We understand, they make us, there's medicines for it to help us, keep our dopamines up and try to make us not so depressed, but so forth and beyond. Depressive cognitive symptoms are caused by changes in processing. Therefore, before making changes to the current epilepsy medication regimen in stable epilepsy or adding new medication, it's important to know the symptoms of a treatable underlying psychiatric etiology or cognitive change. A major depressive episode consists of 4 or more changes in sleep, Now, me, sleep, oh my god, sleep is just crazy for me. I wake up at the smallest thing, or when I turn, or wake myself up, or all kinds of things. Interest, guilt, energy, concentration, or appetite with psychomotor retardation slash activation and suicidation can be present. So therefore, treating ADHD can improve the patient's mood, and some ADHD medications have an additional indication for adjunctive depression treatment. So I'm going to read just a little bit more of this, and then we're going to stop because there's a lot of other stuff too that can affect things. I'll put the description in there, the website where I got this from. Neurocognitive disorders: the sudden stepwise and or degenerative cognitive changes from baseline seen in neurocognitive disorders are unlikely to occur in patients with ADHD. There's a specific memory component. Patients may be unable to provide an accurate history. With patient permission, gathering call information from close friends and family, either in person or briefly by phone during a visit, can help fill gaps in history. I myself do not know in my family history if there's any signs of history of seizures or anything like that. I'm not sure. It'd be hard to say. I wouldn't know. I mean, all my grandparents have passed away. I mean, my uncles are still alive, so I could ask them, I guess. And my mom, she's told me that she's not for sure. So, substance use disorders. Substance use can manifest with cognitive changes. For diagnostic clarity and prior to prescribing a potentially habit-forming controlled substance, obtain a substance use history and consider a urine drug screen. All right, folks. That's all further I'm going to read. Obviously, there's quite different things that you have to be considered to have ADHD, and there's different ways they do it to figure it out, and how they can figure out to get your medicines to not interact with your current medications, such as seizure anticonvulsant medicines, anticonvulsant medicines, seizure medicines, and anti-seizure medicine, and so forth. So it does look like there may be some type of correlation between ADHD and seizures. It's hard to say, it's hard to tell, but they're not sure for sure. And like I said, I probably would have to do some more research on this, because I see some of the stuff that I'm reading on here from this abstract and about this patient or whatever. Not the patient, but how they diagnose stuff is very interesting to me. So makes me wonder, do I have ADHD? I wouldn't know. I'm not a doctor or a neurologist or a person or a psychiatrist or a psychologist or whatever. I'd have to be looked at for so long or whatever. I'm not sure how they do that, but that's what they're trained for. Excuse me. So it does seem like there's maybe a little bit of a correlation between ADHD and epilepsy. So maybe that's why my brain wreck. That's why maybe my brain took a wreck, as I say. But other than that, guys, thank you for watching my channel. This is my brain wreck, and as I said, I'll put some more. I'll put the website in there where I got the information from and so forth. And as a disclosure, again, I'm not a doctor or a neurologist thing. I'm just passing along information that I find interesting to you guys that has seizure disorders or epilepsy, and like to hear some of the stuff, how they do it. And like I said, there's all kinds of stuff in here. Adverse effects of ADHD medications. I'll just read this part. It says some of the most common adverse effects of stimulant used are decreased appetite, headache, or insomnia. While meta-analysis of placebo or controlled analysis in children and adolescents did not support an association of ADHD medication with anxiety or worsening tics, little evidence exists for the effect, especially in adult people with epilepsy. Therefore, each patient should be assessed individually if new or worsening anxiety or tics arise after introducing a stimulant. And then it's down here to say, additionally, stimulants may result in unmasking manic symptoms. Therefore, providers should always obtain a personal and family history of a bipolar disorder prior to starting ADHD medications due to the risk of serotonin syndrome. where your brain gets too much serotonin stuff and causes you to think differently and want to do something that you shouldn't be doing, or you could hurt yourself. Or stimulant, so due to the risk of serotonin, stimulants are contraindicated during the use of monoamine oxidase inhibitors, or MAOIs, or within 14 days of discontinuing of them. Stimulants also hold a black box warning for high abuse potential and should be avoided in patients with a substance use disorder. So, and then down here, one more thing: safety for use in epilepsy. ADHD medications used in people with epilepsy has a controversial history because of concern for lowering the seizure threshold. So, it could lower your lowering the seizure threshold can make it worse. However, evidence, as summarized in more detail in this special issue by Goldpal, etc., all shown that ADHD medications do not increase risk of seizures in people with epilepsy. Even so, prior to starting a new medication, seizures should be stable, and the patient should continue to be monitored closely with regular follow-up to assess for any side effects. So, other than that, there's more to it stuff. So, I suggest if you want to look up ADHD with epilepsy or the compliant or bilateral, they work with. I think most definitely there's some type of connection there that if you're diagnosed with that and that there's somewhere in there that you possibly do have ADHD. So, but like I said, I'm not a doctor. I haven't been diagnosed with ADHD, just epilepsy disorder. So thank you for watching my brain wreck, and you guys have a great night.